Eye Wrinkles, an updated management overview. The periorbital region plays an important role in overall facial appearance and is one of the first areas to reveal signs of aging. The eyes, in particular, are often used as an immediate gauge of chronological age. Consequently, there are many different treatment modalities currently available for use or undergoing clinical investigations. The main targets of the treatments are improvement, if not elimination, of rhytids and replacement of lost volume or removal of excess growth, naturally and uneven skin texture, changes in pigmentation and dryness. Anatomy. The eyes situate in the orbital sockets in the upper face region. The skin that is directly superior to the orbit is also the region where the eyebrows are found. Surrounding and covering the eyes are the eyelids. The eyelids divide into the upper and lower eyelids. At the edge of the eyelids are the eyelashes. The eyelids cover and provide eyes with protection. Deep to the skin over the eye region are the fat bags. The superior fat bag is superior to the orbit, but inferior to the eyebrows, while the inferior orbital fat bag is inferior to the orbit and it contributes to the fullness in the superior cheek region. Laterally to its orbit is a lateral orbital fat bag. There is one muscle that encircles the orbit. The muscle that encircles the orbit is the orbicularis oculi muscle. The orbicularis oculi muscle originated from the frontal bone, lacrimal bone, and medial palpebral ligament. The orbicularis oculi muscle inserts into the lateral palpebral raphe. The function of the orbicularis oculi muscle is to close the eyelids. In contrast, the muscle that opens the eyelids is the levator palpebral superioris muscle. The lateral palpebral superioris muscle is not on the face, but rather is in the orbital socket. Eye movement is under the control of 6 muscles. The 6 muscles that control the eyes are superior rectus muscle, inferior rectus muscle, medial rectus muscle, lateral rectus muscle, superior oblique muscle, and the inferior oblique muscle. The bony structures that make the eye region are the frontal bone superiorly, nasal bone medially, maxilla anter or medially, and the rhizomer makes the inferior and the lateral part of the orbit. The palpebral and orbital components of the orbicularis oculi muscle surround the pretensor and preceptor aspects and function essentially as a sphincter muscle of the eyelid, which is responsible for blinking and dental eye closure. Its direct antagonist is the levator palpebral muscle. Some of the fibers of the superior medial orbital component function as depressors of the medial eyebrow, whereas the superior lateral orbicularis acts partly as a depressor of the lateral eyebrow. Powerful mechanical pressures on the orbital component induce concentric force emanating from the conatonal canthus, resulting in national canthal lines or crow's feet. The zygomaticus
major muscle forms for the angle of the mouth, superiorly, naturally, and posteriorly, in no similar manners as seen in laughing, smiling, and chewing. The trigomaticus minor muscle functions as one of the lip elevators, and both contribute to the formation of the melanopial fold. Mechanical pressures on both trigomaticus muscles produce synergistic effects in the periorbital region, which is accentuated by pressures on the orbicularis muscle, and altogether contributes to the formation of radial oriented force of the lateral canthus.
Eye wrinkle classification. There are two types of wrinkles, static wrinkles and dynamic wrinkles. Dynamic wrinkling is a result of facial mimic that occur due to mood changes, such as fear, shock, frowning, and laughing. They appear and disappear rapidly. The favorite location of dynamic wrinkles are periorbital, forehead, and glabellar areas. On the other hand, static wrinkles do not disappear rapidly. They can be seen even when the facial muscles are relaxed. Static wrinkling favors the perioral region, leg, and malar region. Dynamic wrinkles may lead to static wrinkles due to the loss of collagen with aging. Facial wrinkling is divided into 4 categories according to the Global scale. Stage 1 has no wrinkles, and Stage 4 has deep widespread wrinkling. Fitzpatrick proposed classification of perioral and periorbital wrinkling for use in tabulating the effects of laser resurfacing of the skin. What causes wrinkles? Wrinkles are a natural part of aging process. As people get older, their skin becomes thinner, drier, and less elastic, which means it is less able to protect itself from damage. This leads to wrinkles, creases, and lines on the skin. Facial expressions such as smiling, frowning, or squinting lead to the development of fine lines and wrinkles at a young age. The lines deepen as the person gets older. When a person is young, their skin springs back. As they get older, the skin loses its flexibility and it becomes more difficult for the skin to spring back, resulting in permanent growth. Wrinkles affect people of different skin tones differently due to structural and functional differences in the skin. Research indicates that the compact dermis is thicker in the skin of Black and Asian people, which likely protects against facial wrinkles. Many factors affect the development of wrinkles, including sun exposure, smoking, dehydration, some medications, environmental and genetic factors. Exposure to ultraviolet or UV light from sunbathing, tanning booths, and outdoor sports increases the development of wrinkles. UV light breaks down the collagen and elastin fibers in the skin. These fibers form the connective tissues that support the skin. As this layer breaks down, the skin becomes weaker and less flexible. The skin starts to droop and wrinkles appear. Darker skin contains more melanin and protects from many harmful effects of UV radiation. People who work in sunlight have a thicker chance of early wrinkles, Wearing clothes that cover the skin, such as hats or long sleeves, may delay the development of wrinkles. Regular smoking accelerates the aging process of the skin because it reduces the blood supply to the skin. Alcohol dehydrates the skin, and dry skin is more likely to develop wrinkles. And one reason is repeated facial expressions. Facial movement and expressions such as squinting or smiling lead to fine lines and wrinkles. Each time you use a facial muscle, a growth forms beneath the surface of the skin, and as the skin ages, it loses its flexibility and is no longer able to spring back in place. These growths then become permanent features on your face. How to prevent wrinkles? Here are some tips for protecting your skin and minimizing the appearance of wrinkles. Protect your skin from the sun. Limit the time you spend in the sun, especially midday, and always wear protective clothing such as wide-brim hats, long-sleeve shirts, and sunglasses. Also use sunscreen year-round when outdoors. Choose a skincare product with a built-in sun protection factor (SPF) of at least 15. The American Academy of Dermatology recommends using a broad-spectrum sunscreen with an SPF of 30 or more. Apply sunscreen generously and reapply every 2 hours or more often if you're swimming or moisturizing. Use products with built-in sunscreen. When selecting skincare products, choose those with a broad-spectrum sunscreen, meaning it blocks both UVA and UVB rays. Moisturize. Dry skin shrivel plump skin cells, which can lead to premature fine lines and wrinkles. Moisturizing traps water in the skin, which helps mask tiny lines and creases. It may take a few weeks of regular use of the product before you notice any improvement in your skin. Quit smoke. Even if you smoke for years or smoke heavily, you can still improve your skin tone and texture and prevent wrinkles by quitting smoking. Eat a healthy diet. There is some evidence that certain vitamins in your diet help protect your skin. More study is needed on the role of nutrients, but it's good to eat plenty of fruits and vegetables. Methods of treatment of periorbital wrinkles. The periorbital area is one of the most important markers of chronological age, and third, an essential target in skin rejuvenation that it poses certain difficulties in terms of treatment. Eyelid skin is the thinnest in the body and serves an important functional role in protecting the eyes, making this area a therapeutic challenge. The surgical procedures used traditionally, such as blepharoplasty and rhytidectomy, can result in significant downtime and risk of side effects. Third, are not suitable for all patients. More conservative traditional treatments include topical agents such as retinoic acid, chemical peels, botulinum toxin, dermofillers, and dermabrasion. But these have been largely replaced by newer technologies. Since 1990, ablative and non-ablative lasers have revolutionized the world of facial rejuvenation. While ablative treatments have shown great promise from the start, demonstrating significant improvement in periorbital rhytids, non-ablative
Skin resurfacing was initially met with skepticism due to its subtle and radial effects. Retinoids. Topical retinoids are the cornerstone of treatment for photodamaged skin. The class of retinoids encompasses both naturally occurring and synthetic derivatives of vitamin A. The effects of retinoic acid on motor, hyperpigmentation, fine lines, and skin textures are well known. However, there is less clinical research available for cosmeceutical retinoids. Retinol 1.6% when compared to 0.025% retinoic acid produce less erythema while inducing epidermal thickening and enhancing expression of cellular retinoic acid binding protein CRABP2 mRNA and cellular retinoid binding protein CRBP mRNA. Similar to retinoic acid, retinaldehyde has been shown to be significantly efficacious in reducing fine lines and improving skin roughness when compared to retinoic acid. Nevertheless, identified sufficient evidence of cutaneous penetration and supported to use of retinaldehyde and retinol to decrease fine lines and wrinkles. Chemical peeling. The most commonly used alpha hydroxy acids, AHA, are glycolic 20% and lactic acid 15%, which reduce periorbital pigmentation. The Foley add-on reported an improvement of up to 90% in dark cycles following treatment with 3.75% triacylactic acid and 15% lactic acid. Segmental chemical peel with phenylcroton oil 27.5% phenol and 0.1% croton oil has been used successfully for periorbital wrinkles. This cost-effective modality has been associated with long-lasting Leo collagen lists, and cardiac monitoring is not required when treating one or two facial units. Neuromodulators. The use of botulinum toxin type A has revolutionized the non-surgical aesthetic treatment of the upper face. In fact, botulinum-induced camel devaluation has become an integral part of the plastic surgery armamentarium for the treatment of aesthetic problems such as glabellar and periorbital wrinkles. Botulinum neurotoxins act by inhibiting the release of acetylcholine from vessels on presynaptic nerve endings. This block produces a reversible but long-lasting denervation, which impairs muscle function. On the contrary, non-depolarizing muscle relaxants induce a specific competitive presynaptic and postsynaptic neuromuscular block which is rapidly reversible. Mechanical resurfacing dermoabrasions. Mechanical resurfacing consists of forming microscopic abrasions to the most superficial skin layers. This can include the use of a motor-driven device releasing crystals of aluminum oxide to microdermabrasion, use of sandpaper that is repeatedly passed onto the periorbital area with varying force using one hand, termed manual dermabrasion or motorized dermabrasion. Motorized dermabrasion is the least suitable form to the use in periorbital region due to the likelihood of injury since the skin in that area is very thin and control of eyelid motility can be difficult. On the other hand, manual dermabrasion is the most suitable method for the periorbital area since it allows to very specific control of the depth of tissue involved and the force being applied to the area. Radio frequencies. Radio frequency or RF device for skin rejuvenation has also been introduced. This technology produces volumetric heating via issue impedance and subsequent heat diffusion, and it affects deeper tissue layers than laser-based methods. As with laser therapy, the fractional device deploying RF have also been introduced to improve efficacy and tolerability. One of the fractional RF devices I use the term sublative rejuvenation because the skin remodeling occurs deep below the minimal epidermal ablation and at a sublative level of heating. Microplasma radiofrequency. Microplasma radiofrequencies or RF has been introduced as a new modality in dermatology. Ablative microplasma RF is a non-laser, a non-light-based technology capable of inducing epidermal resurfacing and dermal coagulation. Microplasma radiofrequencies makes use of the discharge of radiofrequency energy which acts on nitrogen molecules in the air close to the surface of the skin, resulting in ionization of a portion of the atoms to form high-energy foci called plasma spark. Energy is released upon return of the gas ions to their former steady states. These sparks, when applied evenly onto the skin, create multiple control channels, like perforations in the epidermis. It produces micro-ablative epidermal thermodomes comprised of coagulated and thermally denatured columns in the skin, with surrounding viable tissue acting as a reservoir of stem cells, growth factors, and inflammatory cells that facilitate rapid rehabilitation. This rapid rehabilitation leads to considerably less downtime with reduced morbidity as compared with other ablative resurfacing techniques. The DAS dermal ablation strategy. Medicals is a plasma plate, an electrocautery device which induces a plasma voltage arc causing the tightening of epidermis and superficial dermis. The energy generated by the DAS medical device is direct voltage current which elevates the temperature of the skin. The mechanism of direct voltage current fluorescence is different from the controlled delivery of voltage current achieved discharge with AC. It affects a much smaller area of skin and does not damage the surrounding tissues. When the tip of the device is applied to the skin with a 2 mm distance, the injections present in the atmosphere tend to sequestrate part of the energy delivered. As top being an insulator is conducted, the ionized air elect. The ionization is called plasma. Platelet-rich plasma. The past decade has also been the emergence of platelet-rich plasma (PAP) as a treatment option for rejuvenating the skin's appearance. Only clinical trials examining PRP for treatment of periocular wrinkles from 2010 to 2016 lacked control groups but demonstrated that both PRP and PRGF provide statistically significant improvements in overall skin appearance, wrinkles, firmness, sharpness, and color homogeneity. Plasma skin technology. Once the only possible treatment of the aging of periorbital areas was surgical or nasal assisted or by injecting fillers since about a decade. A non-invasive plasma technology is available to treat dermatologic and craft fit. Plasma skin regeneration is a novel type of skin rejuvenation technology developed over the last years, and the technology can present itself in four different phases: solid, liquid, gas, and plasma. By adding heat or energy to a gas, this is transformed into plasma. The atoms that make up the gas begin to lose their electrons and become positively charged ions. The lost electrons are then able to flow freely. This process is called ionization, and when this process has involved most of the gas, then it is called plasma device. Using plasma technology deliver thermal energy directly to the tissues at the time of contact without relying on skin chromophores. Microneedling. Microneedling, also known as percutaneous collagen induction (PCR), is a simple method for treating atrophic scar, wrinkles, and inoculation of subcutaneous drugs. In this method, a mechanical tumor is induced into the epidermis and the dermis. The epidermal tumor is quickly recovered to chance epidermal migration, while the dermal tumor is restored to collagen repair. Injectables fillers. The most common used substance to reach adequate cosmetic results and counteract the aging process is hyaluronic acid. It is especially useful in the periorbital area and can lead to excellent results in the hands of an experienced physician. Hyaluronic acid is a glycosaminoglycan, a disaccharide that is found in human skin, synovial fluid, and vitreous fluid. It is a molecule that binds water very avidly and remains bound to it until it is degraded. This allows the molecule to keep giving the skin volume until it completely disappears. Common areas injected include the brow, the upper eyelid, and the tear trough. It is very important to inject only small quantities of the product and to avoid overcorrecting the defect, as it can lead to patient dissatisfaction. In addition, if the midface area is going to be injected, is to be targeted period of the treatment of the radioorbital area, since the former can reduce the depth of the tear trough and thereby will lead to less product quantity used in the latter. Common side effects include ecchymosis, erythema, and mild edema, which can be encountered with any phase injection. More serious side effects can occur from the inadvertent injection of material into blood vessels, leading to necrosis of the injection site and also impolarization of the material and occlusion of arteries. In the periorbital area, this is of particular concern since the ophthalmic artery can get affected, leading to permanent loss of vision. Fortunately, the side effects are rare and become even rarer in experienced hands. Laser resurfacing. Carbon dioxide, Erim-Rang additive and fractional additive lasers using carbon dioxide and Eprium yang were among the earliest lasers used to treat wrinkles and wrinkles. The treatment of dermatoclermis and periorbital rises with carbon dioxide lasers by Astor and Peter shows significant improvement in the appearance. Additive lasers are ideally suitable for lighter skin types as they have significant downtime. The YARG laser has a wavelength of 2,940 nm and its target chromophore is water, similar to the carbon dioxide laser. However, due to its longer wavelength, the YRG laser penetrates tissue more superficially compared to the carbon dioxide laser, also lead to less heat formation and less tissue vaporization. This is mainly why its use has been advocated for superficial wrinkles while carbon dioxide laser is more commonly used for deep wrinkles. However, when it comes to the periorbital area, both lasers have been found to be equally effective in the treatment of both superficial and deep wrinkles. Advantage of the YAG laser over the carbon dioxide laser include decreased incidence of the skin reaction due to the decreased intensity of vaporization and intradermal heat formation, whereas YAG usually leads to faster recovery. This comes of the expense of less collagen tightening and the possibility of leading more sessions when using this laser compared to the carbon dioxide laser. Non-relative lasers like intense punch light, IPL, punch dye laser, PDL, anti-junk 1320 nm, anti-junk 1064 nm, and pure glass 1540 nm are safer treatment options for periorbital rejuvenation. In a study conducted on 31 patients, an improvement in eyelid tightening and eyelid aperture was reported using a fractionated 1550 nm Epium top fiber lasers with no major side effects. the use of fractionated 1410 nm non-tip laser were found to be effective in improving skin flexibility and wrinkles in the periorbital area. 1927 nm toneum fiber laser can achieve skin rejuvenation by increasing collagen and reduction in melanin. The use of non-native lasers is increasing due to the safety profile and low downtime.
Plasma skin resurfacing. Plasma skin resurfacing, or PSR. This emerging method utilizes the state of matter known as plasma to create a thermal effect on the skin through the use of positively ionized gases. With PSR, a gaseous nitrogen source is used to form a plasma. Unlike elective lasers, this modality is not chromophore dependent, and therefore it does not vaporize tissue. This modality may function by forming a layer of desiccated epidermis, creating a natural barrier that facilitates accelerated healing with generation of new epidermis. Plasma resurfacing has been used safely in skin types 1 to 4 and may have a better safety profile than elective laser. This modality has been used with good results in full facial resurfacing. In a recent study, the use of this technology has shown good response to treat a periorbital area for dermatocalaris and wrinkles. Sleeping on an anti-wrinkle pillow reduces facial wrinkles. Longitudinal studies confirm that persistent wrinkles evolve directly from temporary ones. An image-based method was developed which showed that a established unique pattern of persistent facial wrinkles observed using a neutral expression of the age of 8 years were predicted by the pattern of temporary wrinkles observed while smiling. Factors which contribute to facial wrinkle formation include genetic predisposition, environmental influence, habits, hyperdynamic facial expression, loss of underlying skeletal and soft tissue support, decreased skin elasticity, and gravitational force. Underlying mechanical stress is an obligatory factor. If it is not present, as seen on the torso from forearms, wrinkles do not form regardless of photodynamic severity. The loss of the skin mechanical property is significantly faster on sun-exposed than on sun-protected areas. Persistent facial wrinkle formation thus depends on both the cumulative amount of mechanical stress and reduced skin elasticity caused by aging and photodamage due to previous sun exposure. Ultraviolet UV induced skin damage. It is not a cause but an accelerator of wrinkle formation. Sleep lines are caused by repetitive and constant restings of the face on the pillow during sleeping, and body position importantly contributes to their formation. People sleep approximately 8 hours per day, and when sleeping on one side of the body or on the stomach, temporary sleeping lines become permanent after some time. Sleeping can cause irreversible damage to the dermis and adipose tissues in an individual and result in facial deformities. It exhibits long-term tension on the skin, which pushes or pulls the skin in a direction that is the muscle to elongate. Permanent sleeping wrinkles often fade in morning in young, although they may be visible for several hours until the facial skin adopts its initial relaxed state. As we age, this interval prolongs, leading to permanently damaged soft tissue and permanent wrinkles. The aim of our study has to investigate to what extent sleeping contributed to formation of facial wrinkles and whether sleeping on the specially designed pillow reduced them. We adopted methods from the study of Peck et al. To demonstrate that sleeping on the specially designed pillow reduces facial skin wrinkles. Properties of anti-wrinkle pillow. We evaluated the specially designed pillow to reduce and improve facial wrinkles or deformities while sleeping. Standard pillows exert pressure on an individual's face when a viewer is lying in a prone position with the face rest against a pillow, mostly on its central back. The pressure exerted generally unevenly dispersed and result in formation of the facial deformities and wrinkles, especially on the cheeks, around the eyes and the mouth, where the pressure is highest. The anti-wrinkle pillow were designed to redistribute pressures from the central face, the cheeks, eyes, and mouth, to the chin and the forehead. It had a central hole with a centric well to regulate its size to span the user's face while sleeping and to different sizes, which enable the users to choose according to the length of his or her leg for a property leg support. Statement postulated for the first time in his paper, Sleep Crisis, published in 1987, the likely etiology of sleeping crisis, which he observed to form diagonally on the cheek and the lower face and particularly on the forehead. It was noted later that sleeping wrinkles can also manifest as the nasolabial frost and as crow's feet around the eyes. Stedman also noticed that sleeping wrinkles are different than wrinkles caused by sun damage due to smoking, frozening, or laughing, since they are caused by specific sleeping behavior and become deepened over time if sleeping patterns do not change. His theory was later confirmed by Fountain and Gamitin. According to Hildebrand, age at onset and rate of persistent facial wrinkles depend on both cumulative amount of mechanical stress and reduced skin elasticity due to cumulative harmful environmental influence, such as sun exposure. The skin progressively loses its elasticity due to decreased synthesis of pro-collagen 1 and 3, reduced elastin gene expression in the dermis, and decreased proliferative capacity of the skin cells and intercellular matrix synthesis. Considering that most people sleep about one-third of their life, prolonged and repeated disposition of their facial skin will eventually lead to premature wrinkle formation. Nasolabial folds and wrinkles around periocular areas are particularly noticeable on mornings after waking up. The depth of wrinkles usually reduced during day because the gravity caused the cheek to pull down the skin around the eyes, thereby reducing wrinkles. However, continuous and repetitive pressure on the face during sleeping leads to formation of permanent wrinkles. Fountain and Gamintin observed that sleep lies were related to facial attachment of the superficial muscular apparatic system and recommended to release them with a carbon dioxide laser in order to achieve a good clinical outcome. They present an alternative solution to reduce sleep-related facial deformities and wrinkles while sleeping. Sleeping on a specially designed pillow resulted in significant decrease in wrinkle density. The average reduction in total investigated area of the face, expressed as a density of wrinkles per observed skin surface, was approximately 7% after 14 days and 12% after 28 days. Similar results were attained by Brick, who demonstrated that sleeping on pillowcases which contain copper impregnated films reduced depth of skin wrinkles by approximately 9%. On the other hand, improvement in wrinkle density at frontal area of the wrinkles by approximately 9%. Sleeping on the specially designed pillow results in a significant reduction of facial wrinkle density. Rare distribution of the mechanical stress on the delicate areas of the face during sleep can significantly slow down the rate and extent of facial wrinkles formation, especially in users who tend to sleep predominantly on the side of their bodies. The anti-wrinkle pillow may represent an effective method to prevent sleeping wrinkles, 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 wrinkles,